These individuals will always need more frequent consequences around them than will other people in order to perform at the same level. It's just a general corollary of ADHD. So what else have we learned about ADHD? Well, if all treatment is at that point of performance, and if at that point of performance I'm trying to arrange a prosthesis, a prosthetic environment, to reduce the impairment from the disability, right, then it means that the caregivers are the most important people in the treatment plan, the parents and the teachers. It is their compassion for disabled people and their willingness to make these prosthetic accommodations that is the heart of any successful intervention. And absent that compassion, no amount of quality in a good professional or therapist is going to change that. You have to make those people stakeholders. You've got to get them invested. And if they're not, you're in trouble. It doesn't matter how good a clinician you are. So it's best to look at ADHD, I would be telling these families in my office, like we look at diabetes. Largely a chronic disorder, and our goal is to manage it, to create a reduction in the symptoms, the purpose of which is the avoidance of secondary harm. We do not treat diabetes to get rid of it. We treat it to prevent what happens to you if you don't manage your diabetes, because you will go blind, and your heart muscle will atrophy, and you are at risk for sudden death, and you will get gangrene, and you may have your toes or fingers or other appendages eventually amputated if we do not manage your insulin levels. That is what we try to prevent. But no amount of treating diabetes is ever designed to get rid of the diabetes. And I think ADHD is a very good analogy. I think we manage ADHD to prevent the secondary harms, which I'm about to show you. We don't manage ADHD to get rid of it. We manage it so that you don't experience those more heinous consequences.